And welcome back. Well, there's no doubt that pain can slow you down. It can keep you from work. It can keep you from enjoying your life with your loved ones.
But our next guests are here to discuss regenerative therapies that use your own body's stem cells to repair damaged tissue. Dr. Deborah Mangione is back with the doctors at Transform Therapeutics. We have Dr. Scott Stanwyck and Dr. Kevin Tadych, and they brought along one of their happy patients. It's Marna Wagner. And we're so happy you're all here. Thank you so much.
Everyone.
Thank you. Thank
Yeah,
you.
we were just talking about the seminars that are going to be presented where people can learn more about this therapy.
That's right. And so we're all in the same place, same location, and Scott and Kevin started their practice about 2 years ago. Almost 2 years ago. Scott came out of retirement. He is my husband, I will admit.
I'll admit.
She's bragging.
Before
She wanted him to get a lot of stem cells.
before he brings it up, but you know, this was something very exciting. It got him back into medicine in a whole new field, and well, in the field, he's still doing orthopedics, but in the newest field that I think is really going to be the future of medicine, and that's regenerative medicine.
Absolutely. So let's kind of talk about a little bit what it is before we get to Marna's story.
Yes.
What is, so it's stromovascular stem cells. What are they?
So basically, it's been discovered about the stem cell, but what we found out is that in adipose tissue are a lot of regenerative cells we call pluripotential. These are cells that they're really good at making fat, but when you take them, concentrate them, and place them somewhere else, they're really good at making a lot of stuff, cartilage, bone, tendon, and muscle. And so this has been the great discovery, and there's a lot going on in this sphere. The information is coming in exponential forms. It's an exciting time for regeneration.
A lot of people might assume that they work only for a certain age, but is it true that even if you're an older adult, stem cell therapy, regenerative therapies can still be effective?
It's been working very well for a lot of our, I was told not to use the word senior citizens, but that's what we are.
Yeah.
And I know Marna doesn't look her age, but you know, she's almost my age, and worked great, and it's worked great in most of the other people that are over 30.
Yeah.
That's awesome.
So, and I think that's a big thing, because that's a lot of the generations looking at all these surgeries. And I know that was part of your story, Marna, is you had arthritis, is that right, in one of your knees?
Yes, in my right knee, yes.
And what kind of symptom, what did it stop you from doing? Why were you at the point of almost having surgery?
Everything. And my knee was so bad, and I could barely walk, and I have a dog, so I can hardly walk the dog, and you're sliding around. You couldn't sit, you couldn't stand, I couldn't drive the car hardly.
Wow.
There were so many things that affected it. And then when they told me, I finally went into the doctor, and they said I had to have a full knee replacement, which horrified me. I'm like, no, I can't do this. And then, of course, after I told other people, and my husband was telling all these people that I had to have knee replacement, and all the horror stories were coming out. So I'm like, I really don't want to do this. And then luckily he was out one night with a friend of his, and his wife happened to meet him there, and come to find out, her brother had come to see these two guys, and he had both of his shoulders done and his knees done, and he was so happy. So I called him before I went in and talked to him about it to know, okay, what am I getting into, and you know how happy he was. So then I called him, and I met Scott, and he told me what to do, and I made the appointment right away, and I went in, and I've had fantastic results.
And it's almost a year ago now.
May 2nd, yeah, 9 months ago. And you know, actually the first 4 weeks I was very gentle with, you know, walking around just doing normal things, and then I started building up to doing different exercises and stuff, and by the middle of June I was actually out paddleboarding out on the lake, and I went kayaking, which was great because, you know, if I can't get on my paddleboard and I can't get out of a kayak, it's like take that away. It's, you know, no fun for the summer. And walking my dog and just doing normal things, just driving a car was great without being in pain. So,
but getting in and out of a kayak, knowing how low those are, to be able to do something like that with a knee, I mean, that speaks volumes.
I'm back to normal. I can do everything that I want to do now, and I can walk into town because we had moved out into Oconomowoc, and we were only a mile away, and so it was really disappointing when I couldn't go into town and walk there. I was in such pain. I have to tell my husband, go get the car. I can't go home, so now I can do everything. So it's
how long was it after you had the stem cell therapy that you felt relief?
about 3 days.
That
Wow.
quickly.
Yeah.
And do most people require multiple treatments?
No, and we're not absolutely sure why they get relief that quickly, but we think the platelets have a lot to do with that. Platelets have been shown to be extremely powerful pain relievers. And some people have relief even before they leave the office. It's absolutely astounding. Without any anesthetics in the knee, because anesthetics and stem cells don't blend. And but
Are you
we've heard this.
injecting it?
Yeah, we inject the platelets are part of the solution for this. We have to use platelets with the stem cells.
But with that in mind, we see a variability in the time of onset of relief. So we've seen 20 minutes, we've seen 3 days, but we've also seen 6 or 8 months.
Yeah, it's all over the board.
And the key thing here to take home is that somewhere around 8 or 9 out of 10 patients get almost complete relief of their discomfort.
And this not only is something that people use for joints that they may have to have surgery on, but arthritis as well, correct?
Well, yeah, the arthritis is with joints, but we've had phenomenal results with things like tendonitis of the shoulder and tendonitis around the hip, which people call bursitis. It's really a tendonitis.
Plantar fasciitis.
Plantar fasciitis,
Really?
tennis elbow, all that.
And so
And it's
not only
usually-
musculoskeletal, but a lot of the research is looking at autoimmune diseases, and this is where we're seeing some amazing results: type 2 diabetes, Crohn's, rheumatoid arthritis. These are future areas of huge
Exciting.
application of stem cells.
It's done within a couple of hours in the office. The fat is harvested, it's processed, and then delivered back in to the joint.
And
or
always
wherever.
using your own.
Your own tissue.
Your own
so
tissue.
the safety is amazing because it's your
Incredible.
own tissue.
And,
Yes, your
and
body
to get
can't
back
reject
on
it.
that
Right.
old age thing,
Yep, your
one of
body's
our
not gonna
next
reject it.
older patients is sitting next to me.
Really?
Coming up, I trust him enough to have him do it.
What are you getting done?
I'm gonna have my knees done too. I too have gotten some arthritis and I need it. So
I love hearing that.
Wonderful.
Because a lot of times you hear surgical doctors being like, I'd never get that surgery
Yeah.
done.
Yeah,
But the fact that
exactly.
you're doing it yourself speaks volumes.
and that's
the
to avoid the
credibility.
surgery. So I'm really hoping I can. My arthritis is in its moderate phase, but so maybe next time I'll let you know how I did.
Yeah. Maybe
We'll
you
bring
can do
in a
it live on
trampoline.
TV.
Okay.
Trampoline here, you and Marna
film
doing
it.
trampoline.
There we go. Thank you all so much for being
Thank
here.
you.
This is really
Thank you.
exciting. And as we mentioned before, there's this stem cell regenerative therapy seminar. There's 2 of them. One is happening Thursday, February 13th. The other is Wednesday, February 19th from 5:30 until 7. And to reserve a spot, you can call 262-746-9088 or go to transformedtherapeutics.com to learn more.